Well, the first person in the UK, and more than that, in the world, to receive the Pfizer BioNTech vaccine outside of trials was 90-year-old grandmother of 4, Margaret Keenan, as you saw there, right here in Coventry. And the nurse who gave her the jab was May Parsons, and she is here with me. Hello to you, May. What a day for Margaret, for the hospital, but for you. Just tell me what it was like.
It's been all excitement and the sense of pride that we could actually provide this vaccination to our patient is something that is so positive amongst the negative things that's happened this year. I think we're all looking forward to actually giving our vulnerable patients in the community to have some protection from this devastating virus, and I think as a nurse that's really important for me, knowing that they're going to be safe, they're going to be protected, and I think it's just the first step for giving everyone a sense of normality soon, hopefully, once this vaccine rolls out to everyone.
That is everybody's hope, isn't it? That is what this is all about. When did you find out that it was going to be you delivering that world first?
Well, it was last week. It's only because I have been doing the flu jab and the peer vaccinator program in UHCW, where we have trained nurses to actually deliver the flu jab every year. And this year I've done 226 jabs amongst my peers, and because I've had all of that practice, they've deemed that I've had the most numbers, then I would be able to kind of deliver it without any problems, and because of the practice I've had. So yes, that's probably why it was. So I was apparently the most prolific flu jabber in UHCW.
So you're well experienced, but given the significance of this moment, did you have shaky hands at all as you were
Not while I was doing it. I was hoping that it wasn't shaking at all, because for me it was the experience that kind of helped me through the process, because I know that that's what we're supposed to be doing, and the fact that we've had that local policy anyway, we're doing it in and out, day in and out, and 20 years of experience helped me to do that. I think the shakes and the nerves were afterwards, when people were asking me how it felt, and obviously the overwhelming kind of pride for our trust to be the first to actually deliver it in the world is something momentous, really, historically.
And for the nursing staff here,
Yes.
What does it mean?
So for me, I think it's a sense of pride for all of our staff here and all of the people who's actually come together and put all these things to make it possible for today to happen. I think it's just a sense of achievement for all of us that's done it, and obviously my Filipino-British community and the Filipinos around the world, and I'm really, really proud to say that, you know, we do our contributions to the healthcare system around the globe, not just in the UK, so I'm really proud of that.
And as a frontline NHS worker, you will be eligible for the vaccine in these first stages as well. What will that mean for you in terms of giving you reassurance as you go about your job?
I think that's going to be a positive thing. I said to everyone that I've spoken to that the first thing that I get offered it, I'll have it, because I know that then it will give me protection. I won't get it. That means then I won't pass it to my family and my friends, and especially my patients are all already vulnerable anyway. So that for me is ultimately the goal, to protect everyone around me as well as myself.
That must have been hanging over you for all of these months, every time that you go home and every time you come here into the hospital, particularly with the fear of asymptomatic spread.
It has, and I think the first wave of the pandemic is particularly stressful, because the worry is there, thinking that you're taking it home and, you know, and giving it to someone inadvertently. And I think that's why everyone in this hospital and all over the world is kind of concentrating on their PPEs, on their infection control and washing their hands, and all we're ending up with cracked hands and everything, but it doesn't matter as long as we're not giving it and passing it on. I think that's a really important thing.
Yeah, not passing it on both here but also not taking it home to your families.
Yes, definitely. And that was the biggest worry for me, because obviously you wouldn't know until they have it how they will react to it, because it's so new. No one kind of really knows what happens. So it's almost kind of like a trial test. So everyone can have it, but then everyone will have different kind of effects or different experiences of the virus. So that's the main thing for me, to not take it home and pass it on to my patients, really.
And for the vaccine today, how was it for Margaret? Did she feel any discomfort, any kind of side effects afterwards in the immediate aftermath?
No. So basically yesterday I met with her yesterday and explained to her about the lots of attention, because it's going to be a historical event. And I said to her that I just wanted to make sure that she's okay, and that she didn't even feel it.
Well, that's testament to you.
Yes, which is really good. And I think that's a really good feedback in terms of injections. And if people are actually quite anxious about getting injections, sometimes it doesn't hurt you don't even feel it. So most of the people that I've kind of given injections today, I asked them, did you feel it? And then they didn't, so which is good.
Really good. And just tell us what the coming days and weeks have in store for you.
Well, we're going to be obviously running this now. The door's open. We're going to be running the programme seamlessly 7 days a week. So I'm hoping to contribute, as well as my other peer vaccinators and as well as nurses are going to be putting in their time to actually make this work and actually get all the vulnerable patients that we have across the community to get their vaccinations. So yeah, it's going to be a busy week, busy month, but it's all for a good cause.
It's all worth it. May Parsons, thank you